Valerie Svenningsen with ComForcare Senior Services, and I'm going to give you some pointers on how to take care of your senior parents. I'm going to assume during this segment that it's in their own home. One of the more important things to remember is communication. Make the communication with your parents consistent. Open-ended questions. Ask the hard, pointed questions. What did you eat today? What medication did you take? I used to call my grandmother on my way home from work, and that worked very well. It worked well with my timing going home to take care of my family, and I knew that I would be going by her house and could stop and drop anything off if she needed it. Communication is important. Doctor's appointments. As we age, sometimes, actually any of us, when we go to the doctor, it's nice to have someone else there to help us remember what the doctor said and to remember the questions we wanted to ask. It does help to write down the questions and to take notes during the doctor's visit. If you can't accompany your parents to the doctor, you can always have someone else go. It can be a friend or relative that's difficult to manage, or there are caregivers with a non-medical home care company such as mine that does supply caregivers to go to appointments, take notes, ask the questions that you can't ask when you're there. Communicate with the doctor. Many doctors will call you after an appointment. So if someone else takes your parent to the doctor, many times the doctor will talk to you afterwards and let you know what happened during the appointment. I can't emphasize enough the need to organize the information. You are going to need 2 wall calendars to list all of the appointments. I would suggest 2 spiral notebooks. 1 spiral notebook, 1 calendar for your parents' home. 1 spiral notebook, 1 calendar for your home. I would suggest in the spiral notebook you add doctors' names with contact information and possibly their specialty, list of chronic illnesses that your parents have, personal information, Social Security number, Medicare information, supplemental insurance information, if they're a veteran or the spouse of a veteran, and their birthday, including the year. Routine bill information. As your parents age, it may be more and more difficult for them to send in their own bills, the payments for their bills, and you can help with that if you know exactly what they need paid. Banking information, that might be helpful if you are going to help them by making out the checks. Or maybe you make out the check and they sign it, or they try to do it themselves and you just look it over before it's sent. I think it's important for them to stay as independent as they can stay. A list of medications. Medications are important. List the medications, and it might be nice to measure all the medications based upon the day. If you do that, someone else can come in and they can remind your parents when it's time to take their medication. Pharmacy name and contact information is also important. You may need the name of your parents' attorney. That would be for a living will or any other information the attorney would recommend. One of the things I would say that's so important is get help. You can't be there all the time and take care of your own family. Getting help is very important. It may not be medical help, so we may not think of it right away, but it's going to allow you to spend good quality time with your parents when you are with them. So my suggestion is non-medical home care. They can provide transportation, shopping, bathing assistance when it's necessary, toileting or incontinent care when it comes to that, laundry, light housekeeping, medication reminders, so many other services. I'd suggest looking into different companies. It is so important that someone else is going to manage the individuals going to your parents' home. That's the downfall with having family members or neighbors or friends come in and help with your parents. You have to manage them. If they need to call off because they're sick or something else, you have to find the backup, and many times it's you, which means you're missing work. They're not trained usually. With non-medical home care, I know, for example, with our company, we hire trained CNAs, certified nursing assistants. They have a passion for providing care for the elderly, and they know how to provide the care. Some of the tips when looking at a non-medical home care company: check to see if your state, the state where your parents are, license home care companies. Remember, it's non-medical home care, and make sure whoever you're talking to is licensed. Make sure that the caregivers are their employees and they carry insurance and workers' compensation. To make sure that they are employing their caregivers, they're also paying taxes, and that gives you an idea. You never are paying the employee directly. You pay the company. And that way the company is managing the caregiver as well. I would also suggest looking at their hiring process. The hiring process can include things such as a criminal background check, which is very important, a drug test, not just a drug screen, which might be a list of questions, but an actual test. Orientation. You want some set of rules to guide the caregiver that's coming out to your parents' home. Some of the questions that are important for you to ask: how do you handle call-offs? You want to make sure that if someone calls off, they have a backup, even if it's at the last minute. Is there a minimum number of hours we have to commit to in a week? That's important as well. Or per visit. Is there a minimum number of hours per visit? What is involved in the initial assessment? A plan of care is very important, and you and your parents should be involved in setting the goals and specifying what assistance you need for them to have and what they need. Because again, this is all to keep them as independent as possible. I'm Valerie Svenningsen with ComForcare Senior Services, and I've just given you some tips about how to take care of your senior parents.